Welcome back and welcome to the session called Data First, AI Later. My name is Karolina Mackiewicz. I'm the Innovation Director at the ECH Alliance. And for this session, or maybe the fireside chat with the three gentlemen, I'm joined by Professor Rahendra Pratap Gupta, President of Health Parliament, joining us from India. Phil Webb, CEO at Health and Wellbeing 360, joining us from the UK, from Wales, and Jean Philbert Nsengima, Chief Digital Advisor at Africa Center for Disease Control and Prevention. I don't know where at this moment you are, Phil, but I think, are you in Rwanda or joining us from other location?
I'm in Ottawa, Canada. So it's
in Ottawa, Canada, right. Great. Welcome. And in this session, we will chat with Phil, Rash, and Phil on the issues. Why do we need the good data for good AI? This morning, the colleague from the Ministry of Health from Germany said that obviously we need having the good quality data is critical for training the AI models that then should help us solve some issues related to the healthcare crisis. And Data First, AI Later is actually a name of the movement started and funded by Professor Rahendra, joining us here. Just one word of introduction also on the connection of the Digital Health Society and the AI work. As a Digital Health Society, we run the AI Club, and last year a report based on the multi-stakeholder work was published with numerous recommendations, and some of those recommendations are creation of the global framework for standardized evidence-based impact and process evaluation for AI, creation of global evidence, global standard, competency framework, health literacy skills framework, data transparency framework. We can relate to this in this discussion as well, but let's talk about the movement first, how it all started and why it's important, why we need to talk about the data first, AI later. And with this question, I look into Raj. You've been instrumental in bringing this movement to life, and could you share with us why you feel it's important to start this initiative, and how do you envision shaping the future of healthcare with this?
Thank you, Carolina, and thank you, ECH Alliance, and my friend Brian and others who have been behind this, Heather. A big thank you for bringing this topic. And I was watching your previous speakers giving very insightful views on importance of data. But today, I was looking at the other data, the US elections data, and congrats to the incoming president. So with that, I'll tell you what happened is I've been in digital health for a fairly long time. And one thing that came to my mind was when the Prime Minister of Bangladesh asked me to help them write the AI policy. And I was preparing that, I realized that before AI, let's look at the importance of data. And that was the slide I presented, that today, identity of yours and mine in healthcare is not our name, it's our health ID. That's again data. So even if you go a step further, if we, get on the other side of entering the health system because of a complication, our numbers, the diagnosis is again data. If somehow, like people like me who are on the other side of chronic diseases, my HbA1c is again data. And today, my treatment is also data because DTX is AI based on data. So my treatment becomes data and software is a drug. So look at the importance of data. We just think data as raw numbers, actually not. To me, data is the identity, data is the diagnosis, data is the treatment, data is the drug, data is the health coach. So I look at, and I wrote an article in 2019 on this topic about the importance of data. And we have all over the world talked about data as the new oil. Perhaps I would call it water. But at the end of the day, healthcare is all about data. It's data driven. But the health of data is not good. And that's what I mentioned in one of my book in 2019, the 3 I's of data. Integrity of data is a problem. Integration of data is another problem. But we always talk of intelligence, the artificial intelligence. So that's where this can came, and I'll give you the exact point where this campaign came up, where I talked about 3 I's of data years ago in my book. I've been speaking about it. There was a call that we were having in one of the European forums where Steve McFeely, the director of data and statistics at WHO, then was on the call, and I was also speaking. And it was all about AI. And I said, we are misplaced. We are talking of AI, where AI is based on data. So let's not talk of AI first. We should talk of data first, AI later. And I would love to see a campaign like data first, AI later going up, so that, we start with the culture of data. We should create a culture of data, to make sure that the AI that we build is actually a robust one, rather than with doubts and skepticisms and hallucinations. So this is where the movement came up with, and this is where we have formally launched this movement on 30th May on the sidelines of the World Health Assembly in Geneva, data first and AI later. And we are creating global networks to how to get this rolled out to create a culture of data first, and data having integrity, integration, and then intelligence, not intelligence first. So this is all the genesis of data. But where, Carolina, I want more focus, since this is a global forum and people are from all over the world. I know JP is there with me on the call. Good to meet him. So there is the global North's greed for data, and there is global South's need for data. I think Jane will agree with me how much the global South needs data to take care of our health problems. So there has to be a balance between the greed and the need. It's not the big tech who should take the data, and then give us back products which you have to buy. And second thing is, again, following up on that, between monetization and democratization. I think we have to be abundantly clear about the end and goals, so that the extraction doesn't lead to extortion. I'm sorry for using these words, but the collection, data collection principles and the best practices is what we want to intend through data first, AI later. And we are building a very scientific campaign backed by articles, information, and guiding principles on this global campaign. But thank you for giving me this opportunity on this topic. And we hope that we will have more partners to work with going forward. Thank you.
Thank you so much, Raj, for introducing the initiative. And you also raised a couple of things, need for grid and need for need. So the balance between the global North and global South. So perhaps I will then ask the Jean-Philbert also for comment on that. So how do you see that, how in Africa we can balance the need for the local and context-sensitive data with the global push for the AI in healthcare, ensuring both innovation and inclusivity, and how to, what about the partnership or some initiatives that would be critical in making that happen and ensuring this balance?
Thanks, Carolina, and good morning, good afternoon, everybody. Grateful for the opportunity to speak today. And especially this could not have been more timely because we are just emerging from the Africa Health Tech Summit in Kigali last week, where we explored the overall theme of innovating for community health and unleashing the power of AI. So coming from that event, I'd like to share 3 key insights that basically crystallize and summarize what emerged from the conversations at the summit and relevant to the question of balancing local context with global innovation. First, I must emphasize the question of data sovereignty and the local context. As it was abundantly clear from the dialogue on AI innovation, we are seeing how African countries are taking ownership of their health data journey. The statement is whatever is not acceptable to do with American citizen data or Indian citizen data or European citizen data as enshrined in GDPR should not be done on African citizen data. So we are building systems that reflect our unique contexts and disease burdens and demographics, ensuring that AI solutions are trained on relevant data, and developing protocols that will work both in urban and rural settings. And then the other important point that the summit emphasized was some review of successful cases from countries many countries across the continent, such as Rwanda, Kenya, where local context drives AI implementation while maintaining global standard. On the issue of strategic partnerships and ecosystem building, we recognize that cross-border collaborations are essential. And this is really where Africa somehow is at disadvantage compared to India, because India is 1.5 billion people in one country, but Africa is the same sort of size of population, but in 55 countries. So there is an extra effort that we have to make to bring national health systems together through regional bodies and other global institutions. We are seeing the emergence of multi-stakeholder partnerships that combine technology expertise with local healthcare knowledge, involving research institutions, international development partners, and multilateral organizations. And finally, let me talk about sustainability. It's important that Africa prioritizes AI models that address Africa's unique health challenges, especially at the community level. We need to create sustainable funding models through multi-stakeholder partnerships to support AI integration. And that was discussed extensively at the summit. And then ensuring that AI solutions work in low resources, adapt to low resource constraints, such as low connectivity environments, while maintaining overall effectiveness. So I'll keep it at that, but really acknowledge that data first, AI later is really important, because data is the raw material. You cannot build a house without bricks, without cement, without the raw materials that you need to erect the building. So I agree with that premise.
Thank you so much, Jean-Philbert. And yesterday, actually, during the morning session, many times we heard that for a healthy house, for healthy healthcare, you need, of course, healthy foundations. You need vision, you need investment. And here, I think we can also add that you need healthy data to be able to build the good solutions that will allow us to develop better, to modernize healthcare and make sure that actually digitalization benefits healthcare. Phil Webb, your work actually like at the company that works with AI, develops the AI solutions, and I'm sure you work on data. And can you tell us a bit what strategies have proven effective in ensuring that the data quality is prioritized before jumping to the AI solutions?
Thanks, Caroline, and thanks for ECH for inviting me to speak at this. So I think this argument and the very interesting conversations I have heard, including the previous session, is about being able to ask the correct questions in the first place of why you do anything. Yeah. And I think this particular space is more a polemic about human behaviors, equality and equity, and our ability to federate information and knowledge across systems equitably more than anything else from any other sector that I've ever heard. Okay, this should be an ability for us to use human knowledge for the benefit of everyone, irrespective of race, geopolitical region, etc. So this is really an opportunity for us as human beings to create good for human beings across the world using advanced digital and physical technology. So we must be able to ask the correct questions of the system in the first place in order to design the correct systems to answer those questions and collect information that's required, including the quality of data that goes into data collection. So if I had the ability, the godlike ability to wipe the slate clean, we could perhaps develop frameworks, systems, and standards for data collection that would ensure and enshrine good quality data and the use of data equitably and effectively across systems. Unfortunately, we don't have that ability. What we do have is the ability to learn from systems that have caused themselves their own problems. And I'm very interested in Raj's conversation about greed versus need. Yeah. The dominant commercial factors producing products that people have to buy to commercialize information that other people own, right? That's just an upside down system to me, right? What are the countries who, for whatever reason, aren't at the same stage of infrastructure that the Western world is? They can learn very quickly from the mistakes we've made and ensure that their systems and frameworks don't repeat the quite corrosive patterns of data dissemination and the use of technologies that Western populations have adopted, largely around commercialism. So there is definitely an opportunity for other nations to learn from the failures of the Western world in the way that we've constructed frameworks around data to begin with, and then the application of advanced digital technologies to use that data for purpose. Yeah.
Can you give some examples of those failures, of those mistakes?
Well, if you look at the interoperability system in the NHS, for example, yeah, that's largely been driven by companies providing data platforms and electronic patient systems and administration systems, yeah, all of which are competing on a commercial perspective rather than looking at the actual value of the data that's contained there for the benefit of people. Yeah. If these systems were designed for the benefit of people, you'd have seen much more interoperable systems being embedded in large NHS trusts and across the country. It hasn't done that because it's become a commercial issue, not a people issue, right? Now, even though they're public sector and they should have had a public sector ethos in the delivery of this, it hasn't worked out like that. And other countries need to be able to learn very quickly about why they are providing systems for the generation of data and the use of data for the benefit of people. Largely, the issue, the word public has been lost in there in the commercialization of systems and processes to manage data. And that is a failing of the system, and it's to the detriment of the public that they serve, right? So that's just a general observation of what's happened in a system like the NHS.
Thanks for giving this insight. And it always surprises me. We all are people, and those people who build those systems and create those systems are also people. So why we forget about the person, the patient in the center?
If I was going to use an area where we've got the ability to do this correctly, so on a population health level and from an environmental science perspective, bearing in mind, if you look at the impact of environmental quality on human health and well-being, okay, it's 80% of the contributor to it. So why do determinants of health really contribute to the overall health and well-being of nations? Yeah. We are working very carefully to ensure that the data collection to collect environmental level data, both for indoor environmental quality and outdoor environmental quality, is done to standards that are published so that people have to stick to them at the beginning. So we are adopting a data first approach in the way that we're looking at the collection and development of environmental data, including standards around the hardware that's used to collect this information, how it's collected, how it's warehoused, and how it's used. So that is an example of where we're looking at a big player in population level health and are trying from the roots up to ensure that the data is developed in a specific way with standards around it so it can be used to support population health and well-being.
Mm-hmm. And thinking about this public's interest and then having that in mind, and also given the fact that we are at the global event, but still, I think many participants are coming from Europe. So of course, know very well the AI regulations, the European AI regulations. We also know about the UN papers on the governing AI for humanity. I wanted to ask you if you could give us a bit of glimpse and understanding of the regulatory framework in India, in the UK, and here I don't know if the Africa as a whole, or Rwanda, or how can we zoom in, or should we zoom out here in that case? So Raj, can you give us a bit of understanding if and how AI is regulated in India?
So, Carolina, right now we do have the AI broadly, what we call the roadmaps that we developed way back in 2018-20, and it's been something that's churning out still. You know, what India did is very interesting. It founded the Global Partnership for AI, which is now getting together to be a kind of a global regulator with all major countries buying into it. And this is where I see that India is not looking at just regulating what's going in-house, but also working with the world to be in sync with how we need to regulate AI. My worry on this topic is that I think like AI has taken the world by storm, we have gone overboard on regulation. I feel sometimes very disappointed and disillusioned. Everybody, every country is looking at regulating AI. So if you look at how innovations happens when regulations don't exist. And in AI, we are going on an overdrive for regulation. I work on the UN IGF Committee on Digital Health with Commonwealth AI Consortium, WHO. But my worry is that if we go to say that, okay, AI is the next big thing to let's regulate, we are on an overdrive to kill a great opportunity for the world. And that's where my fear is. So on India side, we are very balanced. We said, let's form a global partnership for AI where every country is there rather than us going around and doing. But I think eventually we will also have to regulate. I mean, let's be factual. We have a huge, I think the biggest amount of data of 1.4 billion as the most populated country. But I would not be the happiest person there. So if I look at the global opportunity for AI, because I think AI can be used for creating a lot of opportunities for all sectors, for jobs, for healthcare, but not in the way we are going for it.
Yeah,
I think not in the way for going for it. So I don't know if it answers directly what you asked. India is watching this space, but working with other players globally to see that we have a balanced regulation with innovation.
Okay, I hope I will have still a chance to come back to the, it's not the way or it should be, but I would like to ask João Filbert for, if you can give us a glimpse. And I remember there is a book called Africa is Not a Country. So I want to be sensitive and not ask if it's the whole Africa, or you would like to give an example from your home country around the regulations.
Thanks, Carolina. I actually like that mistake that Africa is one country, because that's what we are tirelessly doing. We launched the Africa Free Trade Area to try and unite all those markets and reduce the fragmentation across borders, which limits the potential of the continent. So yeah, let's take Africa as a country. But I think when it comes to the landscape of AI regulation, I completely understand the frustration that Rajendra is sharing here, sort of a mindset of using regulation to stifle innovation. Africa, I would say we are a little bit late on regulating AI, and that should be an advantage. But in some cases, actually not an advantage, because it's also connected to the culture. There are cultures where the absence of regulation encourages innovation, but also there are cultures where the absence of regulation means absence of clarity and then induces some kind of, I would say, paralysis. So what I've seen across the continent is efforts to regulate, but in ways that don't stifle innovation, but in ways that promote innovation. Because the policymakers understand that the clarity of regulation will go a long way, sort of giving quote unquote the permission to innovate to the innovators, and then the investors who are not sure about the market conditions and then want that clarity to be able to make big commitments. So I can give the example of Rwanda, where recently the country adopted an AI governance framework that promotes innovation through regulatory sandboxes. And that is something that we are really learning from the fintech and looking at how health tech can become the next fintech. Protect data sovereignty while enabling cross-border data flows, which has become a big area of confusion, countries feeling uncomfortable letting their citizens' health data cross borders. But that is also sort of the ostrich policy, where you hide your head in the sand, because we know that data is already crossing the borders with or without their permission. And then third thing in the Rwandan policy, ensuring that AI solutions are tested for bias, ineffectiveness, and context sensitivity, and then balances innovation with ethical considerations. So I would say this approach demonstrates how African countries can be at the forefront of responsible AI adoption, creating frameworks that reflect our realities while adhering to global standards. And it's not about adopting regulations from other regions wholesale, but rather developing contextually appropriate governance that supports our health care transformation goals.
Right, thank you. Of course, it's a very sensitive balance between innovation, regulation, trust and making sure that, of course, there is clarity, but also that people are not afraid of those new solutions and new technology. Phil, can you comment on that from your perspective, from the British perspective?
So the UK's position is a bit murky, unfortunately. And there are two conflicting sets of narrative that have come out. So in 2023, there was a government announcement that AI wouldn't be regulated, but there would be principles about adapting an agile approach to a regulatory framework that looked at trust and transparency in the development of AI. Yeah. Unfortunately, there was a contradictory statement in the King's speech on July 2024 that said the government would actually now look at some legislation and regulation around AI. So the actual position for the UK is grey at the moment, and we don't know which of those two positions will actually take effect. The issue that I see as regulation, and I kind of agree with Raj, okay? When you try and pull the tail of a tiger, right, you have to take the consequences of that. And I see regulators as being yanking the tail of a rather large tiger, and they have the potential to be severely mauled by that tiger when it turns around and bites them. I do think regulation ends up being a form of state control over things that it finds that it's scared of. And the more regulation there is, the more that you can see a state is scared of what it's trying to regulate with. So I would urge people to consider the fact that actually regulation does inhibit innovation. There needs to be standards rather than regulation or legislative control. And ultimately, there needs to be incentives, not penalties, and people choosing the right option designed in the right way to do the right thing. I think if you put a framework like that rewards benefiting populations through application of advanced digital technologies rather than disincentives and penalties against doing things that are deemed to be bad, you will create a more vibrant, a more agile, and a more person and people-centered AI sector than regulation will.
Thank you. And we have 2 minutes to go, so very quick answer to my last question to all of you. Like, in the next 5 years, what is the one thing that the healthcare can do to catch up with other sectors, for example, fintech, in digitalization by focusing on data as foundation for AI? Like, really very short answer. Maybe I will start with Jean-Philippe.
Can you come again? Sorry.
In the next 5 years, what is the one thing that the healthcare can do to catch up on other sectors and using data as a base for AI? Very short answer.
Just quickly to say, I want to push back a little bit against the premise. You know, the catch up is something that sometimes doesn't resonate well when we see an opportunity to actually leapfrog. So I think there are maybe not one thing, but 3 things. Number one is about getting the foundations right. We know that if we get the foundations right, we get standardized health records, for example, interoperability, we build trust through transparent data governance and equity, then we can move first. And then the second is capacity building. I think we have an enormous opportunity here to build capacity, invest in digital literacy for healthcare workers and the people, build local expertise in data science and AI, and create regional centers of excellence to really solve the capacity gap. And then finally, the question of making smart investments. We know that there is money that is looking for growth, and we know that Africa is the frontier of growth. And by just having a good enabling environment, we can sort of unlock those investments. And I think we can just not catch up, but leapfrog. Thank you.
Perfect. Thank you. What about you, Professor Gupta?
So for me, it's like no data is healthcare fraud. So I would say that compulsorily let's capture data at the primary care level and scale it up to secondary and tertiary care. So let's start the culture of data. But no data is healthcare fraud. I mean, we're not delivering healthcare. We don't know what we're delivering.
Thank you. Phil?
So I'd say get the balance right. Yeah. Are you doing this for the benefit of people, or are you doing this to commercialize and make money? There's a balance to be had in that, but the balance is totally wrong at the moment. Yeah. So if you get that part right, then incentivize it and make it easy to deploy if it's the right thing to do.
Perfect. Thank you so much. Thank you for your inspirational words. I think we have to do things right. That's the key message from this session. Of course, by good investment, smart investment, capacity building, and ensuring that we have clarity on how the data is being used, how the innovations are being built, but at the same time that the innovations can actually be created, developed on the good, healthy foundation of data. Thank you so much for joining me today. And we are now breaking for lunch and coming back in half an hour. Thank you.
Thank you.
Thank you.